This is Jude, and this is my project 4 about triage. I love triage. I love thinking about triage. I like having a set of rules to define a chaos. That is like a lot of what I find really appealing about emergency management. So triage is the act of determining severity immediately after a disaster. The most common use for the term is in medical triage, both within an emergency room but also in a mass casualty event with those kind of tags, black, red, yellow, green. But it can also be used in allocating resources, or for example, I would consider these like house tags that were after Katrina, determining like how viable the structure was for living, to also be a kind of triage where you're using a set of guidelines to determine like a category for this thing to fall into, and you're leaving a visual mark on it so that that information doesn't have to be relayed by like a person. You can just like see it and immediately know how to categorize it. Application. For preparation, emergency managers need to have clear guidelines for triage procedures to ensure all responders are working efficiently after a disaster. So knowing what those guidelines are in terms of preparation for like what is considered a walking wounded and everything. And then in action, responders need triage to save as many lives as possible and to organize future response efficiently without needing to sacrifice personnel to communicate directly. So this is a screen cap from The Pit, which has a very interesting couple of episodes with a mass casualty event wherein they are responding, and first, in terms of preparation, before they start to get the victims from the shooting, the head, it's not the head resident, the attending doctor goes through all of the criteria for each category coming into triage. So that's their preparation, is clear categorization, and then after they're able to tag all of these people and send them to the appropriate response so that they're able to get care, and that is how they're able to save as many lives as possible. Challenges. Any ambiguity within the guidelines can be a challenge. So in some cases, there is symptoms which could indicate a like more severe trauma or something, but the person is like still walking or something, and so then like that trauma level could be a little unclear. And some cases present as really extreme, but because they are so much louder, that can distract from more severe cases which need higher priority. And then also situations in which the action of injury is unknown, or the action of illness is unknown, such as chemical exposures, where patients can decompensate rapidly. So that kind of thing where it's like, okay, well, they'd be categorized as green right now, but in 5 minutes, if we don't transport them right away, right, what could possibly happen? Another like exception is a pregnancy will automatically increase a patient by a trauma level, so you always have to be aware of compounding factors, and so making sure that all of your responders are appropriately trained for those exceptions and those cases in which the triage guidelines may not apply so cleanly. For preparedness and planning, in terms of preparedness, we need to be teaching new responders effective triage to create a scaffolding, so that all other emergency response, all other parts of the plan can go smoothly, because if triage isn't done appropriately, the rest of the plan will fall apart because the immediate actions aren't being taken. And the cut and dry guidelines make it possible to organize and manage the chaos on the ground after a disaster, which is what I like about, as I said, emergency management as a whole, is that there's so much going on, and having those guidelines outside of your own judgment to be able to tell you how to respond is really appealing to me. And then planning for disasters of any kind ideally includes the means for trained responders doing triage work. So if you are doing your local emergency planning, you need to be aware of how many responders you have that are trained in doing appropriate triage, because if you're in a really rural area without access to a lot of emergency responders, it's really possible that that is not feasible. And then recommendations for the future. I would recommend that triage definitions and trainings should be done with an all hazards approach. I am coming at this from my triage training being in EMS, but I think that there are other areas of response in which a triage type structure could be applied to individual hazards, and having that same kind of flow chart for immediate response is definitely something I think that could be enacted. I'm not sure. Again, I only have experience within EMS. And all hazards should be considered so situations where symptoms aren't aligned with classic triage definitions can be handled appropriately. So I have an image from the Bhopal disaster wherein the response was obviously slow. It led to a lot of change in laws for global disaster response, because the immediate acute response wasn't educated appropriately for those specific symptoms. So if we have an all hazards approach to our triage training, that will make us more prepared, because triage is, like I said, that scaffolding and that foundation on which most, if not all, emergency response measures are planned. Thank you.